All right. Hi, everybody. Welcome to our Friday webinar. It seems like it's been a while since we've had one, a couple weeks at least. Anyways, today we are back on with Dr. Lamb. Welcome, Dr. Lamb.
Hello.
And Arroyo in the background there. I'm sure Arroyo is going to stay still the whole time like he usually does, right?
Right.
So today we are doing another episode of the Avian Vet Insider. We're going to talk about liver disease in birds. So I don't think this is a topic we've ever dedicated a full hour to. So this will be interesting. And so while we wait for people to log on, Dr. Lamb, I was going to ask you, how are things going as is it the president-elect in waiting?
Yeah, I guess that's what you would say, president-elect in waiting, because the conference is happening next month. So actually exactly next month, right? This time of the month is when the conference will be going on, and it'll be there that sort of the new turnover occurs with the president-elect going to the presidency, the president going to past presidency, the past president, then, moving on. So it's all just sort of in preparation still at this point.
Wow. So is there a lot of pre-planning going into that? When you head off to the conference, is there a lot of...
Yeah, there is definitely a lot of pre-planning. I think people probably don't realize how much behind the scenes work is actually going on to get those conferences together. At least I didn't know, so there's lots of like pre-conference things that we need to do, meetings that we need to do. We had one this last Sunday. There's going to be another one, I think, a couple Sundays from now. Then actually at the conference, there's a whole bunch of little meetings and things too, like aside from the conference itself that everybody sees.
Wow. Yeah, that's that's the conference where just all the potential advances in avian medicine are happening. All those dialogues are taking place at this one important conference that's every year. And where is it at this year?
This year it's in Colorado.
Colorado. Okay.
Yeah.
And it moves each time, right? The location. So
it does. Yeah.
Very cool. Well, that's I'm sure you have some busy times ahead of you in the days and the weeks ahead. So again, thank you for taking your precious time to spend with us today on this topic. And I believe you have a presentation. I'm going to imagine you have a presentation for us because you usually have a fabulous one, right? Before we get to that, I was just going to remind people that if you have a question, use the Q&A button, and we'll see if we can get to questions after the presentation. So don't use the chat feature, use the Q&A button. And with that, I am going to let you take over here.
All right, let me go ahead and share my screen. And start. Oh, my little thing's covering it. Let me try to move that down and so I can see it. Slideshow. There we go.
There we go.
From the beginning. There we go. Got it. All right. Okay. So today we're going to talk about liver disease, and I think it's a really good topic to discuss for anything doing with any medical thing with birds, because we actually see liver disease pretty frequently. It's interesting because different species of animals have certain propensities towards certain disorders. You may see certain metabolic problems more in dogs versus other ones in cats versus something you see more frequently in tortoises. And birds are no different. And liver disease, I would say, is one of the more common problems we end up encountering. So we're going to get right into it. But as I'm sure you guys have recognized, I have a little bit of a pattern here with doing my topics and talks. I always like to talk a little bit about anatomy and physiology before we get into the actual disease process, because it's really important to understand anatomy and physiology in order to really know how things can go wrong. And that's really how you get taught in vet school. Honestly, you get taught what things are, where they are, and how they function normally. And then you learn how abnormal function happens. So this is your mini vet school presentation today. So again, we're going to be focusing on the liver. Here's just a picture of a bird, an anatomical dissection of a bird. And as you can see, here's our little head up here, and we have our trachea. This is our esophagus and our crop. Crop goes down into the body and down into the stomach over here, the proventriculus and ventriculus, and loops through the intestines and then out to the cloaca. We have the trachea that goes down into the lungs that are on either side of the chest. We have the heart here, and that's just right underneath that central keel bone right over the chest, several little glands that are in the neck, and then situated right between the heart and our gastrointestinal tract is our liver. And the liver in birds is bilobed. In different animals, there are different numbers of lobes. And birds have 2 liver lobes. There's the right liver lobe and the left liver lobe. Now, despite what this picture looks like, the right liver lobe is actually the larger of the 2. So in this picture, it looks like the left is bigger, but in reality, the right is actually the bigger of the 2. I think the artist rendition just sort of shows the liver kind of, that right lobe sort of off to the side a little bit, but in reality, the right side is sort of the bigger of the 2 sides. So what does the liver do? I mean, everybody kind of knows there's a liver, but what is the actual function of the liver? Well, it's important for nutrient processing. When you ingest food, the food goes down your gastrointestinal tract, through the stomach into the small intestines. You have digestive enzymes that break down the food into different components, your carbohydrates, your fats, your proteins. And then that gets absorbed through the intestines into the vascular space, and then it gets delivered to the liver. Most of your nutrients that you are ingesting are going to go to that liver first via the portal blood vessels, because the intestines drain blood up to that liver. Now, there's a few instances of certain food items that, or nutrient items that don't go through the liver first. They'll go through systemic circulation before they end up making their way back around into the liver. But most things end up going to that liver first to be processed. And once our nutrients get to the liver, within the liver, there's lots of different ways that those different nutrients end up getting interacted with the liver cells to send nutrients out to different parts of the body, to different cells, or store things within the liver. The other thing is that in that whole process of getting nutrients to the liver, there's also toxins that are being delivered to the liver as well. And so, because there's certain food items that we bring in that are just natural parts of the diet, but have the potential to be toxic. And for example, what I mean by that is proteins. When you break down proteins and the proteins get processed, there's a portion of the protein that's nitrogen, and nitrogen has the potential to be toxic, and the body has to process that and get that out of the body naturally. And so there are natural toxins, essentially, you could say, that are being processed, like the ones from protein breakdown. But then there's also toxins that could potentially be coming into the diet that we really shouldn't be having in the diet, but are getting in, and the liver still has to work on those things too. But there's other things as well. There's, I mean, potentially bacteria or viruses, foreign invaders, things that the body doesn't want circulating around, and the liver is essentially picking things out of the vascular space and processing it and trying to break things down to be no longer toxic, to tell different nutrients to go to different parts of the body, to store nutrients. So the liver is really, really, really an important organ. It also produces clotting factors for the blood. So we all know that if we cut our hand, or a bird gets cut, say we are cutting our bird's toenails, and we hit a toenail, the blood vessel in the toenail, that should clot. But what actually makes blood clot, or there's various components to the clotting cascade, but there are factors that are produced by the liver that helps in clot formation. So if you're having liver problems, you may not be making those clotting factors to the way that you should, and you can sometimes have problems with clotting blood. It also is important for producing albumin protein. Albumin protein is a protein that is circulating around your body in the blood vessels, and albumin actually has various functions. That's really important. It can transport other things around the body, but it's really important for maintaining normal fluid volume within the vascular space. And so the liver is actually what is making that albumin protein and then putting it out into circulation. And when you have good albumin protein in circulation, you keep other fluids in circulation as well. And it's based upon osmotic differentials that happen. The liver also produces bile. Bile is something that's needed for absorption of fat and also fat soluble vitamins. And you know, fats sometimes get a bad rap because of, you know, people thinking, well, fats are potentially too many calories, but we do need certain fats. There are healthy fats in the diet. We need a certain level of fat in the diet. So fat isn't bad. We do want to have bile to absorb fat from the gastrointestinal tract. And of course, those fat soluble vitamins are vitamin A, vitamin D, vitamin E, vitamin K. All those vitamins, they're fat soluble, they are absorbed better with fat, and bile that's produced by the liver, secreted into the intestines, interacts with fats and fat soluble vitamins and allows those things to get absorbed more appropriately and into the body. As I mentioned, the liver is important for storing stuff, and one of the things it stores is glucose. So our blood sugar is maintained, and birds' blood sugar is maintained, and other animals' blood sugar is maintained based on some of the storage of it within the liver. Vitamins, minerals are stored in there. For example, like vitamin A is stored in the liver, and then when other parts of the body end up needing it, it is released and goes to where it needs to go in order to function appropriately. The liver also produces cholesterol. Now, people also sometimes go, ooh, cholesterol, bad thing. But remember that there's also good cholesterol, right? And cholesterol is actually the precursor to hormones in the body. And so hormones are these signaling things that are going on within the body, telling different cells to communicate appropriately and maintain normal functions and homeostasis. And so the liver needs to produce that cholesterol so then we can have other hormones that are produced and have normal physiologic states, normal functioning within the body. The liver also produces or converts, it doesn't produce, it converts thyroid hormone to its functional form. And so there's sort of these, like, you could say non-functional thyroid hormone that then it goes to the liver processes it and produces functional thyroid hormone. And thyroid hormone is really important for sort of setting the tone of the body's metabolic rate. And so we burn calories based off of thyroid hormone. Heart rate is dependent upon it, cell turnover, that sort of stuff. And then the other thing too is it does function in the immune system because, again, as we talked about it, when nutrients are getting absorbed, there's also potential toxins or bacteria or viruses or things that are getting into circulation as well. And by having all those things first delivered through that portal blood circulation to that liver for processing, it is functioning somewhat in the immune system by processing things that are coming through. So these are several of the functions of the liver. It's important to go over them because it really highlights just how important that liver is. I mean, these things are like really helping to make you have a normal, healthy life. Royal just fell. Come here. He's being goofy back there, and he decided to drop down. All right, so moving along here, we're going to go on to our next slide. Okay, so we talked all about the physiology, right? And so as I mentioned, we will need to learn what it does first so that we can understand what can happen when there's pathology, when there's problems that go wrong with the liver. And the reality is there's lots of different liver problems that can occur. And so when we have a bird that comes into the hospital and we are worried that it could potentially have liver disease and we do blood work and we find out that it does have a liver problem, well, then we can go to owners and we can say to them, okay, your bird has a liver problem, but then what we need to do next is we need to figure out what caused that liver problem. What kind of liver problem is this? Because if we're going to do our best job at trying to fix it, then we need to know what caused it so that we can guide our treatments most appropriately. So one of the things that is a really common problem with the liver in citizen birds is fatty liver syndrome, also known as hepatic lipidosis. And that's where you get an accumulation of fat within the liver. And there's actually a few different reasons why fatty liver syndrome can occur. It can occur because of too much fat in the diet. So if you have a bird who has been eating only seeds, it hasn't been eating anything else, it hasn't had other variety, or it's had very specific high fatty seeds, or maybe it's a bird that has been being offered maybe some human foods that are a little higher in fats, and it's getting more of those than it should. Too much fat could cause too much fat to build up in that liver, and then that liver doesn't function as well as it should. But you can also get fatty liver syndrome as a result of certain nutrient deficiencies. So certain amino acids, and amino acids, like we've talked about before, are individual little proteins. And so there's very specific ones, methionine and lysine are the two big ones. If we have deficiencies in those particular amino acids, that can actually predispose an individual to the development of fatty liver syndrome. And then we know in some other species that fatty liver syndrome, and not specifically birds, but we know in like cats, for example, they get fatty liver syndrome when they become anorexic. So if they are not eating for whatever reason, then their body actually starts to break fats down, mobilizes those fats more, and kind of clogs up the liver essentially. And so that theoretically could happen in birds as well. It just seems to be that high fats in the diet are more common causes for fatty liver syndrome in birds. There's also infectious diseases. As I mentioned, things can get through the gut and get into circulation and go to that liver, or they could potentially come in through the body in other ways. And some infectious agents directly damage the liver because they like to go there and they like to cause damage there. But sometimes it's more that, well, these infectious agents are in our system, they're circulating around and they're causing damage to multiple areas, and liver just was kind of a bystander that also ended up being affected. But the viruses in particular that we know sort of have what's called a tissue tropism, meaning they like to go to the liver, are herpes, polyoma, adenovirus. And the bacterial infections that we can see, chlamydia is a big one. I just wrote bacterial infection. I meant general bacterial infections because you can have random bacteria. I mean, things like E. coli or salmonella, that gets into circulation and goes to that liver first and kind of seeds out in there and causes problems. Fungal and parasitic infections can happen as well to the liver, but those are less common, but they definitely can and do happen. It's just some of those things for our pet birds are also going to be a little bit dependent upon like geographical and environmental factors. Other things, cancer, unfortunately, cancer is definitely something we see in our pet birds. And it's something that I find a lot of people are shocked to hear that birds or other animals get cancer, and absolutely any animal can. And when we have cancer, you can have it be primary, so affecting the organ that we're talking about. So like primary liver cancer can happen, or you can have metastasis to the liver, which means you have cancer somewhere else that has moved and decided to affect another location. And the liver is just a big area for metastasis because, again, the liver has a lot of blood flow going towards it. And so the two organs really in particular that are most commonly found to have metastasis to them is the liver and then also the lungs. So when we have cancer in the liver, is it primary or is it a metastasis? We have to end up figuring that out. Liver cirrhosis also happens, and that's basically scarring of the liver. And that can kind of be more of like a sequela or an outcome of other liver problems. So for example, you could potentially have a bacterial infection that causes quite a bit of damage. And then, well, the bacterial infection resolved, they got on appropriate medications to get rid of the bacterial infection, but the healing didn't occur to the degree we would like, which is getting back to somewhat normal. Instead, some scarring happened in the liver, and there's portions of the liver that are not as functional as they once were. Toxins, as I mentioned, because that liver is getting a lot of blood flow to it. Sometimes certain things come into the system and end up causing toxic changes to the liver. And the toxins that we most commonly see are going to be like heavy metal toxins, but you can also sometimes have toxins associated with fungal things. So like aspergillus fungal organisms can produce a particular toxin called aflatoxin. It tends to not be so much that like a bird that has a respiratory aspergillus infection ends up getting aflatoxin from that infection. It's more that that aspergillus fungal organism, which is honestly everywhere in the environment, ended up producing toxin in like a food source. So it's much more common that you have like contaminated food with toxin that then that's how that gets into circulation. Congenital malformations happen as well. Sometimes a bird is born and they didn't have normal development of the liver, whether that's because of vascular changes or something structurally was different with them. Iron storage disease. So iron storage disease is an interesting one. That is where there is too much iron in your body. And it can happen for a variety of reasons. In humans, we know that iron storage disease happens as sort of a genetic predisposition. In birds, we haven't quite figured it out yet. There's lots of theories that are still out there for iron storage disease. But basically what happens is if there's too much iron in the body, whether that's because of a genetic predisposition or because of too much dietary intake of iron, or other reasons. If there's too much iron, it can cause damage to the liver. And that damage over time, because it often starts out where there's really no signs or symptoms of a problem. And so you're having damage and more damage and more damage, and it's building up. And then you can end up getting to the point where you get that fibrosis, scarring, and cirrhosis of the liver. And sadly, sometimes animals don't present until they're at that really end stage of iron storage disease. Now, I put up a picture of a lorikeet specifically on this slide because of iron storage disease. Those little guys are the ones that are, as far as the parrot world goes, sort of the poster children for iron storage disease. But you can see it in other species as well. It has been documented in Bungal macaws. And I even recently had a case where it was found in an African gray. And there's a couple other mild reports, or there's one report in the literature that of 3 different birds with iron storage disease that were African grays. But I don't want anybody to think that this is a common problem in African grays. It's just something that it's out there. It's something for us to consider as a possibility when we have liver disease. But there's many other possibilities. And then also mentioned vacuolar hepatopathy. What is that? That's basically in the liver, you end up getting all these, rather than having a functional liver cell, these vacuoles, these like empty spaces within the liver, and then the liver's not functioning as well as it should. And that can happen. A pathologist, that's usually a diagnosis by a pathologist. They looked at a sample of the liver underneath a microscope and they didn't see any of these other problems, but they saw these vacuolar changes in the liver. And that's more of like a metabolic disorder. It's like there's multiple things that could end up causing that. For example, like too much vitamin A could cause vacuolar hepatopathy. Toxins can cause it. Previous infections can cause it. It's sort of a non-specific change, so it's a little frustrating when we find that on a liver sample, because it doesn't tell us exactly what caused the liver problem, but here's what we're dealing with now. And then heart failure is another thing that can end up affecting the liver, and the reason for that is because well, your whole body really is connected by the vascular system, and if you are in heart failure, you may not be pumping blood around the body as well as you should, and in the event of not pumping blood around the body as well as it should, you can have sort of blood pooling, backing up, and end up causing congestion within the liver. So those are various things that can go wrong with the liver. Now, what sort of signs will you see when you have liver disease? Well, it's variable. You can see a variety of different things. Sometimes it's just lethargy. They're just quiet. they're not acting right, they're not their regular exuberant selves. So sometimes it's really, really subtle. They may also present with anorexia, which is they're not eating anything, or hyporexia. Hyporexia is where you end up having them eating some, but they're not eating their normal amount of food. Vomiting or regurgitation, those can be seen as well. You can potentially see it associated with changes in their weight. They may be underweight, they may be overweight, they may, sorry, Arroyo is wanting to chew things he's not supposed to. So they may be higher in weight because the liver got swollen and it's bigger and they're taking on more weight because of that, or maybe the liver isn't functioning well and they're having fluid build up in their belly, and so they're higher in weight because they actually have a belly that's full of fluid. But they could have weight loss because, again, their liver isn't functioning the way they should, they're not getting the nutrition that they should, and so they're dropping weight. And sometimes when they actually come into the office, they may have poor pectoral muscle mass, so they're underweight, but then they're higher in weight than they were, when they were well, because again, liver is big or there's a belly full of fluid. Clotting disorders. Unfortunately, there's sometimes we don't know that they have a liver problem. And we find it out when they end up having problems with clotting their blood. I've had owners who nicked a little toenail and the bird didn't clot the blood appropriately the way that it should. It was bleeding and bleeding and bleeding. It took a lot longer for things to stop because clotting factors are only part of the whole clotting cascade. There's other things that help with clotting too, but it took a lot longer for things to clot than it should have. Or sadly, there's times where you can have an injury occur, or even a simple blood draw, where if there's underlying clotting disorder, there may be issues with stopping the bleeding. Distended abdomen, I mentioned it because of you could have an organ that's enlarged. Again, the liver itself could be big, or you could have ascites. And what ascites is it's fluid buildup. And so if you remember when I was talking about all the important functions of the liver, one of them is the production of albumin protein. And albumin protein is what helps keep fluid within the blood vascular space. And if you don't have an appropriate functioning liver, you may not have appropriate albumin production. If you don't have appropriate albumin production, then you don't have your fluids staying in the blood vessels as easily as they're supposed to. Fluids can kind of leak out. And that's where you get that ascites, that fluid that then ends up just pooling in the abdomen because it just doesn't know necessarily to stay in the vascular space the way that it should. Thus, when that happens, you can get respiratory distress as a presenting sign, not necessarily because there's a primary respiratory problem, but because that fluid is pushing on the air sacs and making it so they can't get as good of air flow throughout their respiratory system. One thing that's something for people to look at home is the urate. And if you look at a poop sample, there's 3 components to it. There's the poop, the actual feces, which should be like, it varies in color based on what the bird's eating, but should be anywhere from like a brown, green, or some pigment in it from the food that they're eating. The second thing is urine. That's going to be the liquid component to the droppings. And then the third thing is urates, and urates are that white portion of the dropping. So everybody knows with bird poop, that white stuff, that is urate. That urate should be staying nice and white. If the urate is not staying nice and white, if you have a urate that suddenly turns like a lime green, that is an indication of likely liver problems. You can have it turn lime green also with hemolysis, which is breakdown of red blood cells in the blood, but that doesn't happen super commonly in birds. So probably like 99% of the time that urate color change to green is going to be associated with liver disease. You may see diarrhea, you may see loose stools, and there's times where there's no signs whatsoever, which is frustrating because if a bird looks fine, then we would hope that internally it's functioning good as well. But there can be underlying disorders that are happening, but they're kind of compensating, they're doing okay and acting like everything's good. And they may have 0 signs. So how do we look for liver problems, because we know that we can look off of our signs. We can try to look for those signs, but all those signs that I mentioned are not necessarily liver specific. Even the green urate one, that you can be very, very, very suspicious for liver disease in a bird with it, there's going to be a small percentage of the time that it could be something else. And so we often have to do tests to figure out why we have liver, or if we have liver disease, and also why we have liver disease. So usually the first thing that we do is blood work. Blood work allows us to look at how the actual function is to the liver, and we do that through a chemistry panel. So if you go to your veterinarian, you're probably going to, if the veterinarian wants to run blood work, they're going to say, oh, I want to do a CBC and a chemistry. And a CBC is the portion that's looking at red blood cells, white blood cells, and then the thrombocytes, which are the bird version of platelets that help with clotting blood. But then the chemistry is the portion that is important for assessing how the organs are functioning, particularly things like liver function is the main thing we want to talk about. But you can also see it associated, or you can see it helping you to look for like kidney problems, blood sugar levels, protein levels. So but there's two values that we generally look at. There's a couple others, but the two main ones are going to be bile acids and AST. There's also LDH that a lot of people will use as well to assess how the liver is in a bird and get an idea of whether or not there's liver problems. Now, the AST is an enzyme, LDH is an enzyme. Those are enzymes that are released from liver cells when there is damage to a liver cell. And so sometimes you have a bird that has liver disease, but the disease happened sometime prior to when you drew your blood, and maybe there's no more enzyme leakage from the cells, and so your AST and your LDH can be fine. So we really like to look at the bile acids because it's the more sensitive indicator of how the liver is functioning. When your bile acids goes up, that is when you know your liver is not functioning to the degree that it should. And so we often look at bile acids and we look at those enzymes together to get a little bit of an idea of, is the liver functioning well? Could there currently be some cellular damage going on with the liver? Or potentially maybe this has been going on for a longer period of time and we're not having cellular damage. So we have to look at those particular analytes. Now the CBC, even though it doesn't look specifically for liver disease, it's looking again for those changes to white blood cells, red blood cells, and those thrombocytes. And so in particular, one of the big things we want to look at is the white blood cell count, because if we have a high white blood cell count and we have liver changes to our chemistry panel associated with liver, then we might be worried about an infectious disease causing us to have liver problems. And then there's also just in specific disease testing as well, infectious disease testing. So if we have a high white cell count and we have high liver values, then we may go, okay, we need to assess this individual for a particular infectious disease. I may be wanting to run a PCR to check for chlamydia because I know that that is an infection that can damage the liver and cause a high white cell count. Or I may be wanting to do cultures or other diagnostics to really look specifically for what could be going on with the liver. Other things that we will often do is some sort of imaging. And so imaging studies are going to be things like x-rays, ultrasounds, or CT scans. And I have just a couple pictures up here of some x-rays of birds. And this particular bird here, this was a Rosella cockatoo. And this is the heart. And this is the gastrointestinal tract. And if you remember from our little bird anatomy photo that I originally showed, the first slide, the liver sort of lies between that heart and that gastrointestinal tract. So the liver is lying sort of right in here. And right now in this photo, this actually looks pretty good. This bird does not have any liver enlargement, but if the liver was enlarged, it could potentially push the gastrointestinal up and back or to the side. or I might have sort of a loss of detail in this mid part of the body because it's really enlarged and obscuring my vision of other normal structures. And then this picture down here, here is our heart right here, and then we have GI tract down here, and our liver is kind of lying, again, sort of sandwiched between those two. And again, this one doesn't look too bad when it comes to liver size. This bird actually has a little bit of gas in the intestine, so this one has other problems. But as far as liver goes, these two images actually look pretty good for the size of the liver in the bird. So X-rays may be helpful for us to see size, shape, location, but then sometimes we're also needing to do an ultrasound. Now, an ultrasound, we're holding an ultrasound probe up to the belly of the bird, and we're getting a little peek inside the abdomen to look at the liver. And the nice thing about the ultrasound is it allows me to look at the liver parenchyma, and the parenchyma is like the texture of the liver. So X-rays, I can only see the shadow of the liver. And so they're very helpful for size, location, shape. But the ultrasound is really important for the texture of the liver. Is the liver really bright, to where I might be thinking about fatty liver syndrome? Is the liver showing a particular mass within the liver? Is there a cyst within the liver? What does the vasculature look like within the liver? So ultrasound gives me a little bit more idea of the texture of the liver, but it's harder, I should say, for me to assess the size of the liver on the ultrasound. So though they're both imaging studies, they both have their own benefits as to what information we can gather from them. So I wish, there was just one perfect imaging study that we could do that tells us all the information, but the reality is there's not. So sometimes you might hear your veterinarian say, okay, I'd like to do X-rays, and then, okay, I'd like to do ultrasound, and then, okay, I'd like to do CT scan. And you may be like, gosh, why do they want to do all these tests? It's because all the different tests give us different pieces of the puzzle, so that we can really get the best idea of what's going on. Sometimes we get lucky and we find the answer with just one of those tests, but we don't always get lucky. And then just to mention about the CT scans, the CT scan is essentially like taking X-rays, but you're taking hundreds of X-rays and then a computer's compiling everything together. So you end up seeing essentially like a three-dimensional image of the liver and other structures within the body as well, of course. And sometimes we're needing to apply contrast to the studies as well to help us visualize like blood flow through the liver, and again help identify where the liver is compared to other organs. So they all have their own individual benefits to doing them. So your veterinarian may want to do one or the other or a couple. It's just going to depend upon the individual case. Now, the really best way, sort of like the gold standard to really get your diagnosis of what is going on with the liver, is to get a biopsy of the liver. It's really the most definitive answer. And this picture that I have on the side here is actually showing a liver biopsy of a bird. And this bird actually is one that had iron storage disease. This is my one African gray patient that I have that has iron storage disease, so sort of the unique individual. But the reason a biopsy is really, really helpful is because we actually get a tissue sample from the liver and we send it off to a pathologist, and they look at it underneath a microscope, and they can do special staining with it, and they can really tell us what is going on at the cellular level. Is there evidence of infection, inflammation? Is there evidence of something like this, iron storage disease? Is there evidence of cancer? Is there evidence of that vascular hepatopathy thing, which is kind of annoying sometimes to get that result, but then we have at least a little more narrowed idea of what's going on. Is there evidence of fatty liver syndrome? This is really how we get our answer. The problem with this, though, is just that it's invasive. So I do have to put the bird under anesthesia, and I do have to take a sample of the liver. And biopsy is different than fine needle aspirate. You can do a fine needle aspirate before a biopsy. A fine needle aspirate is where they can still be awake or maybe lightly sedated, and then you actually push a little needle through up into the abdomen, into the liver, and try to take a really little teeny tiny, like woodpecker or hummingbird sample size, a really tiny little sample inside of a hub of a needle. You squirt it out onto a microscope slide and send it off. Sometimes you can get your answer that way, but having a bigger chunk of something really allows you to get the most definitive answer. So biopsy is really like the best. It's the gold standard. But again, because the patient has to be under anesthesia, we have to take a sample of that liver. We really have to just make sure that we are choosing our cases appropriately as to which ones have the biopsy, because there's some where, for example, if I have a bird that I'm worried that it has a bleeding problem associated with its liver disease, I'm probably not going to recommend a biopsy for that particular individual, because it could potentially be life-threatening, and we don't want to do that. But there's plenty of bird cases that I've managed where we're trying to figure out what's going on with the liver, and we're doing medications and we're doing other tests, and everything's coming up, not giving us our answer. The liver values are still staying high on blood work. And then we go, you know what, we really needed to get a biopsy because we really need to figure out what's going on. And I'm not so worried about this particular individual for clotting disorders because of XYZ reasons. So I think we should go to take a sample. And I will say, with the one case that I had, and again, it was one, so it's a very unique case, but the one case that I had of iron storage disease in an African gray, I mean, we were managing her with supportive care for the liver and rechecking the bile acids and other liver enzymes over a period of, I think, a couple of years, ultimately is what it was, maybe a year and a half, something like that, before it was just becoming apparent that, hey, you know, we're not really figuring this one out. Something more is going on. Why don't we do a biopsy and see if we can get an answer? We did our biopsy, and bam, that's where we got our answer: iron storage disease, which then allowed us to get the patient on medication that's appropriate to try to manage that condition. So there definitely are benefits to it. I can think of another patient that I had as well that was a umbrella cockatoo that had increases in its liver values for quite some time, trying to manage it. It was not really getting where we wanted it to be. We went and we took a liver biopsy, and we actually found out in that case that it wasn't actually a liver problem. It was a problem where there was the bile that the bird was producing, it was not being recycled appropriately, and it was more an intestinal problem. And so the bird didn't need any sort of liver support medications because its bile acids was high because of intestinal issues, and it was a concern for a bacterial infection that was going on in the intestines that was causing this abnormal bile cycling going on. So when you do your biopsies, it opens up our ability to accurately treat our patients so much better. Okay, so what do you do to treat liver disease? We've talked about how it functions. We've talked about problems that go wrong with it, signs, diagnostics that we need to do. But what do we need to do for treatment? Well, it really depends on the underlying cause. As I showed that slide that had all the different causes for liver disease, we have to take into account that each of those individual things can require different treatments. So fatty liver syndrome, you generally need to have a dietary change. You need to maybe add in some like exercise for the bird, get that bird moving more. For infectious diseases, different antibiotics or different antifungals, if it's a fungal infection, may be necessary. If we find that it's a toxin, then we may need to do chelation. And so again, the more common toxins are going to be our heavy metal toxins, so something like lead or zinc toxicity. And so we may be needing to do chelation drugs. And what chelation drugs are is they actually will bind that heavy metal toxin and then excrete it from the body. The two most common drugs that are used for that, there's DMSA and calcium EDTA. One's an injection, one's an oral. It depends on the individual bird as to which ones we end up doing. But once you're getting that toxin out, then you're then allowing the body to do its more appropriate job of going in and trying to heal things. Iron storage disease. Now, essentially, iron storage disease is all that iron that is in the system and being at levels greater than what it should be. That iron is acting essentially like a toxin and causing cellular damage to the liver cells. And so they also need to be chelated, but it's a totally different chelation drug that is used for iron storage disease than it is for heavy metal toxins. So you can't use them necessarily interchangeably. Iron storage disease patients may also end up needing to have blood draws done. They need to have phlebotomy done to help drop their iron levels. They also need to be on a low iron diet as well. And thankfully, there are some special diets out there that are very, very low iron. And then I put general, because I will say that when it comes to liver problems, there are some general medications that you can put a bird on as sort of supportive care. And milk thistle is going to be the one that's sort of the most common one that is used. And we've talked about it during the nutraceuticals talk, which I think was last month, if I remember correctly. And milk thistle, actually has a few different active components in it, one of which is silymarin, which is what I wrote next here on the slide. But there's other components to it as well. And it acts as an antioxidant for the liver. And being an antioxidant, it sort of stabilizes cellular membranes. It increases the production of that really important protein, albumin, by the liver. And in studies that have been done, they've taken like control individuals, so individuals who didn't get milk thistle, and then individuals who did, and exposed them to similar toxins, and then looked at liver samples to see how did not treating versus treating with milk thistle affect at the cellular level, how did it affect the liver cells, and found improvement with birds that were treated with milk thistle. But it is definitely dependent upon dose. There are different doses for like different toxins and supportive care. So there are studies out there that also show that it doesn't work, but probably not using the appropriate dose. Dandelion root is something that is used for liver detoxification as well. So those are sort of general supportive things that may be prescribed by your veterinarian, like especially in the early stages of, hey, we did blood work, we found that we have liver problems. We may not know exactly what's causing the liver problems because we need to do other tests. But let's get this bird started on milk thistle for general support. We also may need to do just things like fluids. We may need to do assist feedings if that bird is presenting with other signs where they're getting dehydrated or not really wanting to eat on their own. And then those birds that have like fluid that's building up on the belly, they may need to have some of that fluid drained so that they don't have as much pressure on their air sacs. If you have a bird that has cardiac disease that's causing them to have secondary changes to the liver and congestive heart failure and congestion within the liver, then those birds need to be treated for their cardiac disease. And they need to be on appropriate medications that help with the heart pumping and getting fluid off the belly with certain medications. So it really truly is variable how we treat liver disease, but one big take-home point, milk thistle tends to be one of the most common things that is prescribed regardless of what the particular liver disease or disorder is that's going on. Okay, so I'm going to stop sharing my screen at this point because we're in the last about 10 minutes here. Oops, my mouse. There we go. Where I was hoping to be able to answer people's questions that they had for this topic.
Okay, well, we do have some questions for you. That was interesting, fascinating. Yeah, we've got a bit of questions, and let's see, what is our first one is going to be from Anne. A question about budgies. Since budgies are so prone to liver issues, should they be given milk thistle as a preventative? And if so, how much, how often? So you did touch upon that a little bit about the milk thistle. So
yeah, so yes, we do see lots of budgies with liver problems, and I meant to actually put up a picture of a budgie with liver problems because they will develop a sort of classic appearance with their beak in particular. And I totally forgot to put that picture up there now that we're into the talk here. But budgies will get this liver disease can lead to abnormal keratin, and keratin is what our nails are made of, bird beaks, toenails, your skin. And if you don't have normal functioning liver, then the bird's beak may grow funny, and it ends up being more like it grows faster and longer, and they'll get these little like striations in the beak. If you look at the beak real closely, you'll see these like lines running down the beak, and then the tip of the beak tends to be really brittle as well. And the other thing that'll happen, remember I said that the liver is important for producing clotting factors. If the liver is not functioning well, you're not clotting your blood as appropriately, if you like bang yourself on something, you could easily bruise. And it's interesting because birds you'll see little like spots in their beak where they must have just hit their beak on something, you know, and normally it would clot up and no big deal. But rather than clotting up because they didn't have appropriate clotting factors, it ends up bleeding below the beak, and you'll see just a tiny little spot. So they look like little purple or black spots along the beak. And budgies just seem to really, you see it more commonly in them. But should we be giving them milk thistle without necessarily having evidence of liver problems in them? You know, I don't know that I can answer that question definitively, because I do know people who have put their budgies on milk thistle, just sort of supportive care, without having any liver problems, and haven't had them then go on to have problems from having milk thistle. Like, it doesn't seem like milk thistle induces any problems. So it's probably safe to do. I know people who have done it and I haven't seen problems in them doing it. Is it preventing them from getting liver problems? I don't know. There aren't any studies to like, the studies that we have on milk thistles show like, okay, we gave a bird a toxin, we then had our control group and we had our treatment group. The treatment group got milk thistle, the control group got nothing. What actually then happened with these individuals? So we have more like post-problem studies as opposed to pre-problem studies. Like, it would be really interesting to do something like that, particularly in budgies, because of how commonly they get liver problems. I have known some budgies who have had milk thistle in the diet that still went on to develop liver problems. It goes back to, why did they have a liver problem develop to begin with? What was their underlying reason for it? As to probably why some of those individuals went on to develop it despite being on milk thistle. So yes, there is at least some anecdotal evidence to say that you could give it to them, but how helpful it is, I don't feel like I can accurately answer that. So
okay. And then we had a question from Lavanya. Is there a particular liver disease that conures are more prone to?
That's a great question. There is a syndrome called Conure bleeding syndrome, and it's thought that Conure bleeding syndrome, because it's in conures and they are more prone to bleeding. And it's I've seen a couple of cases. It's not like it's all conures out there that have this. It's just there's some individuals, like you go to draw blood from them and they have a little bit more harder time clotting their blood, but they're, you know, otherwise acting totally fine, or they come in with like a huge what's called an ecchymosis, which is like a gigantic bruise on them from something that wasn't that traumatic. So Conure bleeding syndrome is thought to maybe be associated with liver problems, and also people have postulated potentially that previous polyomavirus infection could have been or led to them developing it, but it's still a syndrome, which anything that's a syndrome often means we don't know exactly what causes it. So I will say that in young conures, I have certainly seen more polyomavirus causing liver problems in them. But once they're adults, or if they've been appropriately vaccinated for polyomavirus as babies, you know, there isn't one of those particular types of liver disease that is more common. As a general rule, for citizen birds or parrots, fatty liver syndrome generally tops the list. But that's a generalization for all different species of parrots.
Okay. We have a question from Gloria about protein electrophoresis.
Yeah, protein electrophoresis.
Thank you. Is the most reliable test to determine liver disease? Is that a reliable test to determine?
Well, so what it is, so the protein electrophoresis allows us to look at the individual proteins within the bird's body. And so it's going to look at albumin protein, which again is that protein that's really important that is produced by the liver. And then it looks at globulin proteins as well. And globulin proteins are ones that are more important for like inflammatory responses. And there's different types of globulin proteins. And what some researchers have found is that certain globulin proteins might be altered more frequently with liver disease, but it's not a guarantee of liver disease. So I wouldn't say that it's the best diagnosis for liver disease. When it comes to blood work, bile acids is going to be more accurate to indicate that a liver problem is going on, because what research has shown is like, so the beta-2 globulins will go up with liver problems, but it depends on the underlying liver problem, and beta-2 globulins can go up associated with other problems as well, versus bile acids tends to go up mostly with liver problems, but sometimes you can end up having cardiac disease that ends up secondarily causing liver problems that makes your bile acids go up, or like the cockatoo that I mentioned where he had a problem with like the recycling of his bile with it from the intestines to the liver, that his bile acids went up because of that abnormal recycling. So occasionally your bile acids is going to go up with other problems, but it's by and far way more associated with liver problems than your globulins being altered. But it's good to do a protein electrophoresis because it also adds more information, a few more pieces of the puzzle. Is there an inflammatory component to this problem going on? Okay, if so, what sort of inflammatory conditions could be present? And then also look at our albumin protein. Where is our albumin protein? Is it at a level that's really low? And I'm really concerned about that. I might be at a more advanced stage with this patient's liver problems versus, you know, the albumin actually is kind of okay. So that's a good thing. The liver is still producing good amounts of albumin. So I don't have to worry about like them having fluid build up in their belly at some point, that sort of thing.
Wow. Okay. And then Jane wanted to know, can you safely take enough blood from a budgie for tests other than a CBC required to access the liver issues?
Yes, you can. I mean, I've taken blood in from birds as small as finches, which, you know, a little zebra finch is like 13 grams. A budgie's like double that. So yes, you can get blood from a budgie, but I will tell you, there are times where I've had budgies come in that they have that very classic appearance to their beak that I go, ooh, this looks like liver disease. And, you know, I may not want to draw blood on your budgie just yet, because again, it goes back to that clotting problem. And if a bird has severe enough liver problems that they aren't clotting their blood appropriately, and you're a teeny tiny little budgie, and I can only get a certain amount of blood from you because you're small, and I can only get a certain amount safely from you. And if you're having problems clotting your blood and you don't clot your blood well, and you can only give me enough, a little bit before it becomes life-threatening, then there have been times where I'm like, I'm afraid that I might hurt your bird, that I could potentially even cause your bird to die if I draw blood. So for you, I'd love to draw blood. I'd love to know what your liver values are, but I don't think it's the smartest thing for you. So we're going to treat you as though you have liver disease because you're really suspicious in other ways, or we're going to do some other diagnostic tests. We're going to take x-rays or do an ultrasound, something else to get me a little bit more information. We're going to treat you like you have liver problems and then see how you're doing. And then maybe later on, when I'm feeling a little bit more comfortable that maybe you're less symptomatic, maybe later on we'll draw blood on you. We'll see. So.
Wow. Do they have an option of a blood transfusion for a little bird? I
mean, we do.
Yes.
You know, certainly I've done blood transfusions of birds before, but the problem is with those really tiny guys, because they can only lose so much blood. The timing that you have between like okay blood loss and critical blood loss is too narrow. And so having somebody for a blood transfusion is like in those cases where you really truly have clotting problems, there's not enough time to be able to do a blood transfusion.
Wow, that's amazing. I'm just imagining a little tiny blood,
yeah.
So then Dr. Rico said, is it worth measuring ammonia when doing a blood test? Does that tell us anything?
That is a very good question. And there's a lot of controversy as to how much ammonia birds actually produce. And so it actually does vary. So normal physiologic healthy individual, some produce more ammonia than others, and it's dependent upon the species. And we don't know really what happens when they have liver problems as to do they end up producing more ammonia or not, because ammonia isn't the main nitrogenous waste product that is made in a bird. It's more that uric acid that's produced. So there isn't a lot of good research to say whether or not you should measure ammonia levels. So I will say that typically that is not something that is measured, but I would honestly love to see more research about that to see if it is something that we should be checking more, because there's so much we don't know about, like Arroyo, like how much ammonia does he produce versus African gray versus Amazon. Like we don't have that information to actually even know those normals yet. So
oh wow, yeah.
Yeah.
That's interesting. Okay, and then we have a question from Elizabeth about how is a radiograph different from an X-ray? So,
same thing. They're the same thing. It's just that like veterinarians tend to say radiographs because we are taking radiographs. The X-ray is the like X-ray particle beam that's like coming down to make the image. So for veterinarians, we like to be, official and say radiographs, but most people know what we're talking about when we say X-ray. So it's sometimes easier to just say
they're interchangeable is what you're saying.
Yeah, common lingo of X-ray.
Kind of like necropsy versus autopsy, right? Is that?
Yes. Yeah, sure.
All right, let's see. Wow, I mean, we have a lot of questions still for you. I mean, this is one of the bigger questions webinars we've had in a while. Let's see. So we'll either, let's see if we can do a follow-up webinar, because this apparently is just such the topic is just inspired a lot of questions, or maybe we'll try to tackle the rest of the questions via email and send out some answers. But yeah, the hour went by really quick, and we have like 24 questions still.
Oh, geez.
So wow. Okay, so now we know we have a lot of this is such an important topic for bird owners. So maybe a future topic on maybe a
actually you might need a part 2 in the future, like we've done before on other topics.
That's right. And you can show us the budgie beak.
Yeah, I could get that in there.
There we go. Okay. Wow. Okay. So I got a couple announcements to make. First of all, we have a winner for our giveaway today, and I don't have a video to show, but I'll show the product. Yeah, I got one here. This is going to go out to Janice. Let's see if we can see it. Shoot, I'm trying to show it. Oh, okay. It's the foraging pack. It's the foraging fun pack. It's the new, hopefully you can see it. It's the, there we go. Latest and greatest Lafeber offering. So we're going to send some of these out to you and your bird, as well as another Lafeber product if your bird's liking. And then another announcement. So we do have a webinar, an extended webinar for next Friday. We're going to be revisiting avian bornavirus, I with Dr. Susan Rose and Dahlhausen. So avian bornavirus, avian ganglionitis. That'll be next Friday. It's going to be a special 2-hour webinar. So we're going to start an hour earlier. So mark your calendars. Like, for example, 11 a.m. Pacific Standard Time is when we would start. And then we'd go till 1. And then we'll be back on with Dr. Tolley for Ask the Vet on the following Friday, which is, what is that? That is July 29th. So last Friday in July. So there we go. All right. Covered a lot of territory this time around. And Arroyo just went AWOL. We have no idea where he's just
over there hiding.
Oh, he's doing, looks like he's doing office work. There you go. Okay. So Dr. Lamb, thank you once again for walking us through that. And then we'll consider doing a follow-up webinar, because there's so many questions still.
All right. Awesome.
All right. So just want to thank everybody for joining us today, and have a great weekend. All the best to you and your flock, and everybody stay safe. Till next time. Bye.
Bye.